Noor Ali, Dr. Noor Healthcare Advisor.
Hey, it's Kellen, and today on Diversified Game. Excuse my throat, you guys. For those of you who follow the Instagram, you know we were in Europe for a couple weeks, and my singing voice is just coming back. But today I have medical doctor, Dr. Ali. I say that because now everybody's a doctor. You know, they're a doctor in leisure studies, and we ask them, do surgery? Huh? What? Huh? What? But Dr. Ali is going to give us the game on how she's a medical doctor, but she's also an expert in insurance, and her company helps people find the right insurance. So, Dr. Ali, welcome to the show. How are you doing?
Thank you. Thank you so much, Kellen. Super happy to be here. Thank you for the opportunity for having a conversation with your listeners today.
Yes, yes. This is a conversation. I just want full disclosure. I love this conversation because I'm married to medicine. So I hear all the good, the bad, the ugly. And I know that you did not just create this company to make money, where many people think people went to like medical school just for money, but you're not doing this just for money. There is a money component, people. Don't get it twisted. But, this is not just money because there's billions to be made in insurance. But can you give the game on why you, as a certified doctor, why you said, I'm going to create a business to help people and companies find insurance?
Yeah, thank you, Kellen. Thanks for asking. I was recently on another podcast, and they said that it was a question about like what does it feel to be in healthcare, and I was like, actually, I'm not in healthcare. Insurance is insurance, and financial services is an entirely different industry, an entirely different field that I myself had to learn. So, as a medical doctor, I trained abroad in my home country in Bangladesh, and when I came back to the States. Insurance was very foreign to me because in my country, in Bangladesh, there's no insurance system. Everything is pay per fee. So when I was seeking my own health care, I was very frustrated with deductibles. I remember going to a doctor's visit in January, it was the start of the year, and I hadn't yet met my deductible. So I received a big bill. And I was super angry. I was super frustrated. Like, what is this? This sucks. This is a scam. Just like how everybody else, sees insurance. And I really saw a gap that, just because I have fantastic clinical and medical training doesn't mean that I understand health insurance. In fact, I don't understand it at all. So that's where I kind of saw and identified a gap that even though you can be in healthcare, you cannot have a clue about health insurance. And that's not okay because health insurance dictates your care and your overall health outcomes.
And I'm sure, you're looked at by the folks who don't know, I don't want to name call today, not today, I blame the doctors. They're making all the money. And so that's why things are so expensive, not understanding that usually most hospitals are run by somebody who didn't go to medical school. They probably have an MBA, but that doesn't, they disconnect. Can you go maybe even further in solutions? Do we need more hospitals ran by doctors who aren't just looking at the bottom line, but looking at healthcare and how we can improve the care and the cost?
Yeah, that's a great point, Kellen. All my doctor friends who are like at my level or peers, they're all broke. They don't have money. And they have to figure out their own solutions because insurance companies don't like to pay doctors enough. And then it's a whole other topic about direct patient concierge services, what a lot of my colleagues are doing. So I think it's a myth that you think that hospitals are run by doctors. They're not. They're run by people with business and management backgrounds mostly. And doctors are not always making money. Some of them are, and a lot of them aren't, especially those who are either running private practice and don't have a whole lot of experience, or they're contracted with insurance companies and big insurance just isn't doing a good job to take care of their doctors and their providers. In terms of a solution, one thing I always say is I as a single person, I don't think I have the capacity or the bandwidth to uproot all of the pieces of the broken system and fix it. What I can do is help you understand it and leverage your current position to make the best of your situation. So, but you asked me, what can we do? If we are talking about solutions, I think having kind of these blended backgrounds for myself, being a clinician, a medical doctor, a surgeon, and having business and insurance experience, we need more kind of those combination type unique experiences for running systems. So for that hospital administrator, having some clinical knowledge would help. For that medical doctor, going to business school and learning insurance and management would help. So kind of seeking out and seeking to marry these industries, I think would give really rich experiences that could develop better solutions.
And you being an expert, in insurance and medicine, some may look at your LinkedIn and say, well, you went to Yale, you can fix this. It's really political inside the hospital, and even the hospitals dealing with the laws changing statewide, county, federal. Would you ever run for politics to maybe clean some of this up, and or at least go lobby for the people?
My answer to that is hell to the no. I wouldn't, and not because of the cause or the way, but I think that I can make an impact in a different way, and that's just not my way. But it's a great point. It's a great avenue. It's a great way to do that. I like to just do it in my own way to utilize all of the knowledge that I have learned and make an impact. And for me and my company, this is the way that I'm doing it right now, is I'm talking to individual people, understanding their problems with healthcare and health insurance and offering an advice and solution. So this is my way of doing it right now.
Okay, we try to push the burden. Heavy is the head that wears the crown. But she also wants to keep her sanity. So I understand. I understand. What type of savings are you finding for your clients? And talk about who your clients are. My clients are a lot of influencers, some physicians and people. My wife says, hey, they need help.
Yeah.
But give us the game on who your clients are and the savings, because the bottom line is where people are like, how do you save me money? And I know you
Yeah.
do work with content creators as well and marketers and all that.
Yeah, I do. I do. So let's take a look at that. Let's take a look at an influencer who's doing really well, and maybe they're in their third, fourth year of their career, and they're making good money, right? When it comes to health insurance and having to figure it out for yourselves, we're going to take the 50% of America who has like great corporate benefits or works for a big company. They're good. They have good benefits. So let's take them out of the equation. Let's say you work for yourself and you got to figure it out on your own. There's two categories or two spheres that I like to talk about. You've got the public healthcare marketplace and the private healthcare marketplace. The public healthcare marketplace is a great place to shop for your health insurance if you're very low income, maybe just starting out, or income under 50K. The reason for that being is any income between 20 to 50,000, the government is willing to give you a tax credit or subsidize a portion of that premium to offset the full price of that policy that you're getting. However, they do come with high deductibles. So if you're chronically ill, if you have a major pre-existing condition and you know that you're going to get a big surgery this year, you're going to meet that deductible, that's also the only other time that makes sense. Otherwise, I don't really talk much about the public marketplace. So if you're low income, chronically ill, you don't travel too much, that's a great place to shop is the public marketplace. Now, what if you're making more than 50K? What if you're generally healthy? You take care of yourself. You hardly ever go to the doctor, but you value quality healthcare because that's America, right? You need good insurance to get good healthcare. And maybe you travel, maybe your work takes you outside of where you are. That's a time where I suggest let's look for something in the private market. Now, the private insurance market has so many different options, hundreds of companies, thousands of plans. I'll talk a little bit about what I specialize in and what I advocate for a lot, especially as a medical doctor. So I love working in this tiny space in the private health insurance sphere called medically underwritten health insurance policies. Now, this is something that pretty much disappeared in 2008, but certain spaces and certain pockets still have it. So this is a type of a plan, Kellen, where instead of using your income as the primary determining factor for calculating your insurance premiums, we use your good health. So the younger and healthier you are, we may go through a simple underwriting process to lock you in at a lower rate. Now, as your business grows, your income goes up, your health insurance premium is not going up. And now you're locked into this quality healthcare plan that's going to guaranteed renewal no matter what happens to you. So that's really the kind of stuff that I advocate for. And when I speak to people who kind of fit that category, high income earners, generally healthy, I always point them in this direction and everyone's super duper happy. And you talked about cost savings, like why should I do this? Is it more expensive? Actually, it's not. It's actually 30 to 40% less than what you would pay for the same comparable plan, if not better or worse on the marketplace, and you get a ton more benefits.
Awesome. Thank you for explaining that. And also for, there are so many now influencers who have teams of people,
Yes.
and they're like, well, In certain states, there's about, I believe, five of them, you have to provide health care for your people. My home state of California being one of them, where I got
Mhm.
married in Massachusetts being another, and
Uh-huh.
the list goes on. Um, are there any plans that are set up for having your virtual teams, in this country and globally? Because now, you have a team member say, I want to live in
Yeah.
this country, but I'm here. So are there
Yeah.
any, plans out there that you know of?
Yeah, yeah, I love this question. I love working with small teams, with remote employees. It's beautiful. The challenge is, though, I think we still haven't solved that national and international challenge because when you cross national borders, now you're into either travel insurance or an international medical plan, which is a little different. But what I do love working with small teams who have remote employees, you always want to go for a PPO plan. So PPO refers to the network of doctors that you have access to. And one example I always like to say is you can have an amazing plan that covers everything head to toe, costs you $0.00. But if you can only see that one doctor that's 100 miles away, you're not going to be happy, right? So the network of doctors and providers and hospitals you have access to is super duper important. So you have the choice, choose the PPO plan, which is great for remote employees. And another thing I like to talk about is when an employer comes to me and says, hey, I think I'm ready to start offering some type of benefit. What are my options and what can I do? I always advocate for the employee first. And I say, let's talk to your person, let's talk to your guy. What do they want for their healthcare? Do they necessarily need vision and dental? Are they looking for like a high quality top tier plan? One example I like to use is you can have an amazing group plan that has great maternity coverage, but if you have a team of young 20s male, that's completely irrelevant and they don't care about that. So it's actually a way to cost save for an employer if you just kind of talk to your employees, ask them what kind of benefits they need and want, and kind of customize and tailor to some individual plans that you can then, as an employer, pay the whole thing for, or pay 50%, 20%, whatever you can offer, or even a stipend or a credit and say, hey, here's 200 bucks towards your health insurance. Talk to Dr. Noor, figure out what you want, and you guys, you get the plan that you want. And that has always worked so well because it saves the employer bottom line, it saves them money on not giving unwanted coverage. It makes the employee so happy because now they have a plan that they own. They're not necessarily tied to that company for health benefits. They can make career decisions independent of their healthcare benefits, and they're just happier with the coverage. So it fosters employee retention.
Okay, but and just to clarify, nothing particular though. If you do have a team member who moves to Mexico, moves to Kenya, and says, "Hey, can you cover me under this plan internationally?" Any tips on that? Because I want people to really come bother you for these complicated questions, but I
Yeah,
want them to have some type of basis first, so they don't
yeah,
just take up all that 15 minutes for free. And that's the only thing
that's
she's
right.
giving for free. Yeah.
No, thank you. That's a great question. It's just different territory. So when you're traveling internationally, again, the question would be, what are you looking for? Are you looking for travel and trip insurance coverage or accidents while you're abroad? Or are you looking for like actual medical care abroad? In that case, it might not make sense to get a national policy and expect it to cover you abroad. It might make sense to get a local policy where you are, depending on the laws of that state. But national insurance coverage is typically not going to cover you internationally. Then you need to get trip insurance, traveler's insurance, or international medical insurance.
Gotcha. And this is why we do this, because it's an international platform. I just happen to be here in Florida now, but you guys know my spirit is just ready to travel and the bag is already packed. Um, Also, let's debunk some things because YouTube University is, just like any university, you get what you want, but, it's almost like it could be Trump University where we're going to teach you whatever you want to know about. And the algorithm will show you what you want. And there's a lot of people on, social media saying, oh, yeah, get health care, put it in this account, then cash it out in this other account. You can even buy your Super Bowl tickets. I mean, I've heard some crazy stuff. So, is there any financial benefit that's legal? Let's be clear, that's legal, that allows you to, I want to cover myself, maybe my family and employees, and later on, if I don't use it, I'll take it out like it was some whole life insurance scam. I mean, policy, sorry.
Yeah, that's so funny. I think, Helen, what you're touching on is if you have like a high deductible plan and you pair it with an investment vehicle like an HSA, there's a little bit of playroom there, some tax deductions there. One thing I will clarify is if you pay a premium to an insurance company, you are never getting that back. Whether you never use your insurance a day or not, premiums are going to be non-refundable. Unless, of course, you cancel in the middle of the month. Sometimes you can get a little bit of that back, but you can never get premiums paid to an insurance company back. Now, if you have a high deductible plan and you pair it with an HSA, now you're putting away your own dollars, towards a savings account because your insurance company is not going to pay when you have an emergency, which is very, very unlikely. So to meet this high deductible, you're squirreling away more of your own money into a savings account. That's money that you can potentially play with. But my advice is why would you, and I feel very strongly about this, let's take a young healthy person, right, in your 20s, 30s, 40s, don't really use health insurance, take care of yourself. The industry has kind of given the psychology that, well, you don't ever use your insurance, why don't you do a low premium, high deductible plan, pair it with an HSA? Well, now you just guaranteed three separate times that in the very little chance that something happens to you, you paid all of that premium. Insurance isn't going to pay anything until you meet your high deductible. Your deductible is so darn high that you had to put away your own money in a savings account to afford to pay your deductible. So when exactly is your health insurance company paying? They aren't. You just kind of insured that they're never going to. So and then the focus is now then, okay, now I have all of these dollars in my HSA that I put away. What are some things that we can do with that? But if we zoom back a little bit, that why do you have a high deductible plan to begin with? You as a healthy individual, there should be a balance. I'm not saying pay the highest premium for the lowest deductible. All I'm saying is there should be a balance to a premium that you can afford and a deductible that's reasonable to make sure that if and when you need to use your plan for an emergency situation, it's your insurance company that's actually coming and paying, not you.
And if you guys want to go even deeper and maybe you say, oh, what do they know? Read Ramit Sethi's book, I'll Teach You How to Be Rich, and he'll give you some other game that will say, oh, voila, okay, it's all making sense. Because I think people they want freedom. We know that. They want to have the flexibility. Everybody wants to be whatever they call rich, but it's how do you get there? And when you start listening to bad people, you start thinking, oh, that's legit. If you want to be Robert Kiyosaki and owe 800 million to the government, fine. Another show. But we're talking about things that are above board and that everybody could do. Let the people know how much insurance is too much. Because when you talk about the high premium, some people then, oh, I'm just going to get everything and I'm going to cover all my people. I have the money now. I made, enough money, whatever that is, because I don't know what enough money is. I haven't made that much yet. I'm still waiting, But what is the too much, do you think, for a healthy, person under 40?
Yeah, that's a great question. And it's always hard for me to give numbers out on a call because each case is so individual and just depends. I will say when you're evaluating, like what is a good insurance or good premium or whatever, I want you guys to focus on the max out of pocket, right? The max out of pocket is a dollar amount that you, if anything happens to you, you give this to insurance and you know that insurance is going to cover the rest of your bills no matter what. So we want to know what that number is and we want to make sure that we're comfortable with that number. We have enough money in the bank in a savings or something that you'll never face medical bankruptcy. So that's how I want you to kind of go about this is can I afford this monthly premium? Is a deductible okay? I'm sure it's not the best, but it's okay. Maybe I won't meet it any year. I'll never meet it, but in the case of emergency, can I afford that? Okay. And then the max out of pocket. This is like a contract between you and insurance that, hey, insurance, I'm going to pay you this. You better pay all of my bills no matter how high they get. So you want to make sure you have that put away in the savings, and that's the marker that I would go about.
No, that's good. That's good. And what about do you focus on people for their retirement and what that will look like if they ever have to go into a nursing home, if that will be covered? Because when you go into nursing homes, they have some that are 30,000 and up a month, and they look sweet with the wine on tap, the beer on tap. But then you have the places where they'll just wheel you in front of the window and no one will say anything till it's time to eat. Do you also focus on that for your clients?
Great question. My market is really like 18 to 64. After 64, it's like a Medicare, it's a whole different ball game. But the insurance plans that I work with do cover all the way up to home health care, hospice, and skilled nursing facilities like that. So it's important to look at kind of that fine print of not just how is your insurance going to serve you now, what happens 20 years later if you do need to go into a nursing home earlier than you anticipated, what is your coverage then? So to answer your question, yes, the plans that I work with do have that. Even if I'm talking to someone in their early 20s, I do point that out that, hey, we're talking about an insurance plan that's going to last you until you're 64 years old. Well, what about that care that you need in your late 50s and early 60s? This is how it's going to cover you then.
Awesome. What is your community give back that you're doing or that you would like to do in the future?
What, I'm sorry, that question
Your,
again? Oh,
your community give back that you are
okay.
doing, like when you operate in India, or one
Yeah.
that you would like to do in the future?
Yeah, and it's Bangladesh actually, not India. But what I do is
Okay.
to keep my license active, I do go back to my home country, and all the surgeries and all the help that I do is voluntary. So I help out my friends there who are still practicing. Just offer my services for free, whatever need is there. Last time I was there was in 2020 for COVID, so I helped out in the COVID ward. So depending on what is needed, I just volunteer my services. I'm also working on launching this new project. It's called Think Like a Woman. And it's a net worth catalyst brunch that I'm hosting that's invite only open to my clients. And the concept is, we all work so hard to get to where we are now. I want to now leverage my high net worth network to help you get to your next level. So those are kind of the impact driven work that I'm working on the side.
Think like a woman. Uh-oh. Steve Harvey is going to be coming over. Maybe he'll come speak, and then it won't be any beef, whatnot. So
That's
that is
funny, Kelly. When I was doing some market research for this, and I made the mistake of asking a group of like 40s, 50s males about just some very early stage market research. And the first feedback I got is, think like a woman. That sounds horrifying. I was so offended. I was like, you just butchered my entire concept.
Yeah, I mean, if men were smart, especially if you're single and you're trying to date, you might want to think like a woman so you know what she's looking for. Because when you're an employee, you should think like your employee, your employer
Yeah,
think like your employees to see what will benefit them. The same way the folks who run the hospital should think like the physicians, the nurses, which it's a 2 million shortage for a reason, you guys.
yeah.
And there's a lot of things that we could help with that because people are dying when doctors take off and nurses get sick and take off because there's no one to care for them.
Mhm.
What about, and here's some more pressure for you, your book? Is it ready? Is it out? Or when can they pre-order?
Book is not ready or out. I feel like I'm lacking some core life experiences. So I have like the start and the middle, but I need to experience a little bit more to give this more depth and tie it all together. So we're still working on the book. Thank you.
Okay, so you're one of those thinking you're only going to write one. No, you have a series like Seth Godwin. You might do over 200. So
Oh
yeah,
my gosh, thanks, Helen. Yeah, I've never ever thought about that, but thank you so much.
yeah, there's no way with your experiences even thus far you can write one and you won't be like Eureka, I got something else, or you're gonna have somebody ask you a question and then you're gonna be like, I could write a whole book on that. So
Yeah.
yeah, I'll tell you like Tupac told the Outlaws, just put it out there. The hook or the title is the last thing this person said. Boom. Because we need that book because you have some unique experiences, and I think the thing I love about your story is you're qualified. We have a lot of people who are just talking, and they'll take even the bits that you said right now, and they'll act like, oh yeah, 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 but at some point it stops. And everyone's an expert in America, especially. Um, so I just love that. Let the people know. I know you have a beautiful website. I did not see the YouTube, TikTok, or maybe your own Clubhouse, your Twitter, that Elon. Where can they connect with you and get more of like your game and stay abreast of what you're thinking about and how you're moving?
Yeah, thank you so much, Kellen. So my website is always going to be there. So that's drnoorhealth.com, DrNoorhealth. On top of that, I love being on Instagram. That's my social media platform of choice. So you can catch me on Instagram stories all the time. I'd also love to connect with you on LinkedIn. I'm on LinkedIn. And more recently, I've started doing TikToks, but I feel like I'm kind of aged out of that, but I'm trying. I'm doing my best. So maybe you can catch me on TikTok on a good day.
You guys, she said aged out. This is the problem with the brilliant folks. They think as soon as they hit 21, they have aged out of something. No, you haven't aged out. These social media platforms are for everybody. And even when you create the metaverse, your own metaverse, it's for everyone. So you guys have gotten the game. Now the important thing to do is to share it because it will change someone's life. Let me take this off air so I can put some more pressure on Doc and ask her, some things that I don't want you guys to know yet. So you guys be blessed. Thank you, Doctor, for coming on.
Thank you, Kellen.
Hi everyone. Have you ever been curious about visiting Africa? Which African country were you interested in? Kenya, Nigeria, Uganda, South Africa, Ethiopia? Which country are you interested in? My good friend, Kellen Cash Coleman, came up with a course called My First Trip to Africa that'll guide you through this process. It's only $20, and in this course you'll learn about passports, visas, vaccinations that you need before you go there, as well as a budget, how much the trip is going to cost. He also talks about what you should pack, what you should take with you, how you should travel on a budget. Did you know that $100 is worth 1,000 South African rand and over 10,000 Kenyan shillings? So imagine what you can do with $100 back home. I say back home because I'm from Sudan, I'm African, I already know how it's like. I know that, when you convert Canadian and American money, it goes a long way when you're traveling across Africa. So if you're curious, if Africa is a place that you've always wanted to go, always wanted to move there, Kellen Cash is the person to ask. Check out the course. There's a little preview you can listen to before you actually purchase it. If you're interested in this course, visit www.diversifiedgame.com. Don't miss out.